This is me testing the camera on, I'll just say it. My phone was like $50. So I just want to see how the camera works.
Hi, everyone. My name is Dr. Danielle Kelvis, and I'm a United States trained medical doctor. I am currently treating, I would say, around a good three or 400 people for acute depression. And I created this YouTube channel honestly out of just an abundance of need. I really care about all of you guys. I wish I could talk to and treat all of you guys on a weekly basis, but unfortunately I just can't. So, but even if you're not my patient, this video series can help. This YouTube series will be on how to cure depression. But before we get started, go ahead and hit the like button and subscribe below and leave me comments. Feedback is very important to me. I have been practicing for several years now, and this is just some things that I've learned along the way. I have personally struggled with depression my entire life, and there are a lot of just simple daily consistent things that you can do to truly cure your depression. Now, I'm going to go ahead and list on the side here, kind of break down the categories and different topics that we will talk about. Okay, so I want to go ahead and just say what this is not. This is not a quick fix. Biology, unfortunately, is not 2-day Amazon shipping. It takes consistency, it takes commitment and time. You did not develop depression overnight, and there's no just pill that's going to make everything go away. Another reason why I created this YouTube series is because patients will often come into my office and I only have a few minutes with you, truly, and they want a pill that will make everything go away. While there's definitely a need for medication, that's not the whole story. And there's numerous studies to show that medication truly is only like 15% of the journey. You've got to put in the work and the effort, whether that's in counseling or, keeping a mood diary, whatever, but we'll get into more of that. I just want you to know, though, that I am so proud of you for making it this far. You have survived every single one of your worst days. And I promise, if you just stick to this, you will get better. There is a hope of eventually coming off medication. I think there's this kind of behavioral pattern where patients will start on medication and be on it for life. And in some people, that is warranted. There are some severe psychiatric diseases, illnesses like mood disorders and things where you truly do need medication every day. But the vast majority of us do not. Just some background. I'm not going to go into the statistics of depression because we already know that half of everybody is depressed. If anyone ever says to you that they've never struggled with depression, they are lying. Everyone at some point of their life, some situation, something will happen and they feel depressed, whether they want to admit it or not. We're going to go through staging and tracking your depression, the 8 most common triggers, the types of counseling, who needs medication, acute stress versus trauma, and then we'll get into a little bit of resistant depression. My plan is also to eventually create guided meditation videos. Meditation has been clinically proven, and it's been practiced for thousands of years as a phenomenal way to control the subconscious mind, treat anxiety, depression, and you'll notice just an improvement in every area of your life, honestly. I will say, though, just this. I practice global health and evidence-based medicine, and if you look at the studies, there is a tremendous global burden of disease caused by untreated depression. The total burden of disability increased by 52% between 1990 and 2017. And if you look at this graph here, mental disorders are the kind of the purple on here, and millions of people struggle with depression all over the world. Some of the acronyms that are very commonly used, like DALY, it's a way to quantify the number of healthy life years lost, basically, to disability. I want to go over just some of the biggest symptoms, and as clinicians, what we use to kind of gauge, do you meet criteria for a diagnosis of major depressive disorder? And the acronym we use is called SIGI-CAPS. So S stands for sleep disorders, where you're either sleeping too much or not at all. I stands for interest, or better known as anhedonia. This is where you just lose interest in things that you truly used to love. You have no motivation to get up out of bed and do anything. G stands for guilt. So this is where you feel worthless, hopeless. E is for energy, where you're just chronically fatigued. Normally things would energize you, or things that used to, and now they just don't. C is like concentration, where you just can't read. I mean, you can hardly focus on the TV. A is for appetite. So some people, when they're struggling with major depression, they will eat so much more, or they'll just have no appetite at all. A lot of my patients report feelings of nausea. Sometimes they'll even vomit. P is for psychomotor retardation or agitation. And then S is for suicidality. I want to just explain, though, there's two different types of suicidality. Passive suicidality, which everyone at least once in your life will just have those thoughts. What would it be like if I weren't here? You do not have a plan. You do not acutely want to die, but you'll be driving home and you just imagine, what would it be like if I just ran my car off the road? Acute suicidality, though, is where you have a plan, you truly wish you were dead, and you really need to seek help. So to meet the diagnosis of major depression, a patient has to have 4 of these symptoms plus decreased mood or anhedonia for at least 2 weeks. To meet the diagnosis of dysthymic disorder, you have to have 2 of the 6 symptoms plus depression for at least 2 years. Another kind of scoring method that I use with my patients to quantify their symptoms, determine, are you getting better, are you getting worse, is called the PHQ-9. So for those of you acutely struggling right now with depression, I want you to go online, keep watching this video. You do it after the video, but go to mdcalc.com and type in PHQ-9 and do the survey. And it'll ask you a lot of questions about how you're feeling. And I do this with all my patients every time I meet them for a mood follow-up appointment. And it will give you a score. So 0 to 4 means, minimal to little no symptoms. This is something that I just need to monitor in you. And this will change day to day. Maybe you just have a really crappy week at work and you may just shoot a score of 3, whatever. A score of 5 to 9 is mild. 10 to 14 is moderate. And then above that is severe. And it's if you consistently have a score above 10, I really encourage you to find a physician, go ahead and get into counseling, because you're at very high risk of getting worse. I also encourage that my patients keep some sort of mood diary or food diary if you struggle with an eating disorder. And there are tons of these free PDFs online that you can download. And I'll list a couple examples here. This one is just like a blank calendar. You can, write a smiley face or put 1 or 2 words of how you were feeling that day. You can have like daily mood charts. I prefer these because it's got times and you can be very specific throughout the day. And this will help guide your healthcare provider. Do you have a mood disorder? I actually bought a journal. This is my self-care daily planner, and I fill this out on a daily basis. It's got times. I write all over it. I read every day, so like I'll put, notes and stuff that I've read. And this is kind of an accountability piece for you, because depression, it comes in waves. You'll be really struggling. You'll go get help, start counseling. You'll feel good for maybe a couple weeks, but then it will return. And it's important to track all of those things, because you need to start paying attention to your triggers. And that's the next part of this video series. There's a lot of research surrounding if depression is an evolutionary thing. And it makes sense, because as a species in the last 100 years, we have progressed substantially, so much faster than how our brains or bodies have even developed. A lot of things that contribute to depression are things like poverty, social isolation, physical inactivity. We sit now so much more than we ever have before. I actually went out and bought, you can kind of see the corner here, but it's a thing that will actually raise my desk so that I'm not spending all day sitting. We also have food insecurity and food deserts, especially in the United States. We have poor working conditions, lack of job control, and we all experienced that this last year, where certain industries just completely collapsed and people lost their jobs. We also have shift work now, where people will be working all night. We are not nocturnal creatures. We are meant to go to sleep. We are not meant to be awake and alive all night. I'm going to go over 8 triggers. So trigger number 1 is, do you have an organic medical disease? It could be something like metabolic disease, thyroid issues, vitamin deficiencies. This is why if your PHQ-9 score is greater than 10, you really need to go see a physician. They need to do labs on you, do a full physical exam. There could be something else going on. If you're hypothyroid, for example, yes, you're going to be depressed, and it doesn't matter how much self-care and good eating, clean eating, exercising you do, it won't make any difference. I am currently, at the time of this recording, I am accepting new patients, but that will change very quickly. Most physicians carry thousands of patients. I'm only going to carry maybe like 800, and it's just because I want to give very focused, detailed care to my patients. So trigger number 2 is bad sleep. Especially in the United States and the UK, we have weapons of mass distraction, our cell phones, constant notifications. I was at a coffee shop the other day and I saw a 12-year-old with an Apple Watch. Now, I love Apple. I'm not hating on them. I have my Macs. I love them. But we are not designed to have chronic, constant stimulation. We don't take enough time to be still, and we work usually right up until bed. Now, when you're younger, in your adolescent years, you need a good solid 9 or 10 hours every night. But so many kids now, they'll stay up till 2 or 3 a.m., especially during the summer, playing video games, what have you. What is that, Harry Potter? I am solemnly swear I am up to no good. But we're looking at screens until very late at night, and the bright light travels through your optic nerve, goes to your brain, and tells your brain, hey, it's sunlight, you should stay awake. This prevents the natural secretion of melatonin. It also just completely destroys your circadian rhythms. And there's a plethora of research out there. Around 11 to 12 at night, you should get a normal spurt of growth hormone, okay? And then at 7 to 8 a.m. before you wake up, there should be a natural spurt of cortisol. This is normal. This is why, like, sometimes you wake up and you're just, like, hot. You're kind of sweaty. It's your hormones doing their thing. When you are going to bed at all different times, you're waking up at random times, it destroys your circadian rhythm. It messes with your blood pressure, your fasting blood sugar, especially for those people with chronic diseases like diabetes, heart disease. It's even more imperative that you have good restful sleep. You can Google a lot of stuff on sleep hygiene, but that includes sleeping, first of all, in a comfortable place, making it a cool, dark environment, okay? Don't have TVs, don't be on your phone and electronics right up until you go to bed. We talked about the light and how it keeps you awake. Have soft music. I meditate or I'll read a book. I don't work up until bed. I have a consistent bedtime and a consistent wake time. At my age, I'm okay at 8 or 9 hours. As we age, it's natural that you need less sleep. You may be fine with just 6 hours. That's okay. It's not something that you need to medicate. For a lot of people, if you could just get your sleep better, all of your depressive symptoms would go away. So a lot of times people come in with the chief complaint of depression, when in reality, their medical condition that needs treatment is insomnia. I have a lot of patients too that have smartwatches and it'll track their sleep cycles and stuff. Now, I don't know how accurate those are, but there's many different stages of sleep, okay? And your brain goes into different brain waves. So whether it be like deep sleep or REM sleep, rapid eye movement, that's where you dream. Some people who have been through really bad trauma have debilitating nightmares, and they'll wake up with panic attacks. Again, panic disorder. Those are more reasons why you need to see a physician, and we can get into the nitty-gritty of that. A really, really common cause of bad sleep, honestly, is something as silly as sleep apnea. Not that sleep apnea is silly, but you're partially suffocating at night. If you're partially suffocating, for sure you're not going to get good sleep. Sleeping with a CPAP is not very sexy. I recently just did a test. I've been diagnosed myself with mild sleep apnea. I'm not totally over myself yet that I will get a CPAP, but I will. I will do it because I want to sleep better, and for sure it's contributing to my own depressive symptoms anyway. But have your physician just order a really cheap, easy sleep apnea screening. If you're waking up and you're fatigued all day, you wake up with headaches, or your partner notices that you snore, or like you just breathe really weird at night, just get screened. All health insurance companies pay for it. We have free screening with my patients here. Quick and easy test.
Okay, guys, that's the end of part 1. Thanks for watching. I will post part 2 next Sunday. Have a good week.